How can you tell if it's a disc injury or facet joint irritation?
So we have the nucleus pulposus and then the annulus fibrosus on the outside. In younger populations, what you tend to see is that nucleus pulposus is still full of water and it has the ability to actually herniate through and cause that damage. Tends to become less filled with water in older ages, and for that reason, we tend to see less disc herniations. We see facet, that tends to be more associated with cartilage degeneration, more pressure on the facets, the straight leg raise. So if we wanted to bias flexion, bias that disc, we would bend this side to bring the back into a little bit of posterior pelvic tilt, a little bit of flexion, and then straighten it out and check. And then if we want to bias the facets, what we'll do, have both legs straight, bias that anterior pelvic tilt, have the patient hold their leg up here, and then resist here. Pulls on the psoas, brings the low back even more into extension. Bring their knees to chest. And we're looking, does this relieve or increase their symptoms? If it increases their symptoms, we're thinking more disc. If it decreases their symptoms, we're thinking more facet. Whether it's facet or disc, check compression. So in neutral, if we compress, we might see that regardless whether it's facet or disc, they might have an increase in symptoms. But we can bias again by having the patient roll forward a little less, good, and then press again. Is this better or worse than at neutral? And then extend. Is this better or worse than at neutral? Another way we can tell is whether the patient presents with radiation. Disc injuries tend to radiate down the leg. The pain radiates with the disc is that the structure, the actual disc is pushing onto the nerve, whereas if we have a healing facet joint, that might cause inflammation in the area, and we might see that the inflammation, excess swelling, facet injuries, which can also radiate down the leg, but more often, not as often as disc injuries.